Good morning. Good morning. Wow, I'm impressed. All right, well, we're going to do it again, though, because I know you guys can do better than that. Good morning. Good morning. Wow, you guys are morning. How many of you guys are morning people? Okay. Okay, so it was all of you guys that said good morning. All the rest of us, because I'm not a morning person either, we're going to try it one more time. Good morning. Good morning. All right, that was awesome. I'd like to welcome you all today. My name is Shawn Yancey. I'm a news anchor at Fox 5 here in Washington, D.C., and I am honored to be the host for today's program. We want to welcome you all to the White House observance of National Women and Girls HIV Awareness Day. What was that? Say it again. Woo-woo! She gave a little shout out back there. I am honored to see you all wearing red. You're looking fabulous. Those of you who aren't, I still see shades of red on you. You can just like have your friend put their arm around your shoulder or something. All right, so how many of you have Facebook, Twitter, Instagram, something? Raise your hand. Okay, so while we're here today, you will undoubtedly hear something that needs to be shared with your network of friends. So make sure that you share it. Take a picture, take a selfie, show your red, but let everybody within your network know that today we are celebrating National Women and Girls HIV/AIDS Awareness Day. Before we get started, okay, now's your chance. Take selfies real quick, and then I'm going to take a selfie with all of you. Are you guys ready? Hold on. Let's see if we can do this. Okay. I'm trying to get everybody ready? Say cheese. Okay, hold on, let me see. Isn't there like oh, there's a panda one here. Why? Wait, I don't know if it does selfies. It doesn't do selfies, so I'll tell you what. I will take the picture of you guys. All right, everybody ready? Let me see if I know how to do this. Okay, go. Okay, now I hope I did it right. I have to take it home and have my kids figure it out to make sure I know what I'm doing. All right, so how many of you have already taken a picture? You took a selfie with someone you're sitting next to so you can put it on social media? Everybody? Okay, good. Make sure you do that. All right, it's time to get started. We have a jam-packed program for everybody this morning, so we're going to get right to it. Here to welcome you is a true friend inside the White House. She fights every single day at the highest levels of the federal government for women and girls to succeed. She's assistant to the president, chief of staff to the First Lady, and executive director of the White House Council on Women and Girls. Please put your hands together to welcome Tina Chen.
Well, good morning. Well, thank you, Shawn. That's a great way to start. Pictures, selfies, photos. I have lots of friends and leaders in the audience. Thank you all for being here. And more importantly, on behalf of the president, who is about to lift from the South Lawn to go to Atlanta today, and Valerie Jarrett, who is, wanted to be here but is out of town, I bring you their greetings and also their thanks. For everything that all of you do every day. And not only in the work that you do, but in the courage and the grace that you all show in speaking out about these important issues that we're going to address today. And, stepping out of the shadows, for our title for this gathering, couldn't be, more appropriate and more of a salute to all of you and to the many clients that all of you serve. We know that, the gender disparities that we need to address here around HIV transmission, around violence against women, around women of color, are, some of our most challenging. And I'm very proud, though, of a lot of the work that we've done. So some of today is to address challenges. Some of it today is also to celebrate successes. And, for example, we've got great news that the rate of new HIV infections decreased by 21% among Black women from 2008 to 2010. But we also know that Black women, yep, absolutely. But we also know that Black women still represent 63% of new HIV cases among women, and majority of women, they are the majority of women living with HIV. And the rate of new infections for Hispanic women is more than quadruple the rate for non-Hispanic women. But I will tell you, it is particularly important to have you here during the month of March, because as many of you know, in a couple of weeks we will celebrate the anniversary of the passage of and signing of the Affordable Care Act. And, this remains, one of, the great steps forward in so many ways around healthcare for our country, but in particular on the issues that we face today. Because, there are an estimated 12.5 million women of color. That's 5.1 million black women, 4.9 million Hispanic women, and 2.5 million Asian American women who now have private health insurance with a guaranteed access to women's preventive health services. On top of that, we have, as Secretary Burwell announced yesterday, over 11 million folks who've signed up in the most recent round, to sign up for healthcare on the exchanges, who never had healthcare before and who now have healthcare. And for all of these folks, both private insurance and on the exchanges, what the Affordable Care Act did was to make sure an important part of preventive services is HIV screening for everyone without additional cost, or cost sharing, and importantly, intimate partner violence, screening, so that we can get, these issues identified and we can get help to people. It's so key. And the other thing the ACA did that we don't often hear about is $11 billion in increased funding this year for community health centers, for places where a lot of our community goes to get their health care. So this is, the great news that we have and that we need to get out. But we're going to keep working. We know, for example, that only about half of the women living with HIV receive medical treatment. Only 2 in 5 have achieved viral suppression. Women facing intimate partner violence have particular challenges in being, intimidated from getting treatment, intimidated from in their relationship, having preventive measures being taken. That women in abusive relationships have 4 times the risk of sexually transmitted infections. And so we need to really speak out and address these issues, which I'm so really glad that you all are here today to do. I'm just delighted that we're going to be joined this morning by Doug Brooks, who you'll all hear from in a moment, who leads our efforts here, and our very new, and you're among the first to meet her in her new capacity, our new Violence Against Women advisor, Carrie Bettinger-Lopez, who will be stepping into the role Lynn Rosenthal had here to lead our efforts on violence against women. So again, thank you all for being here. Thank you for what you do every day, for the loud voices that you have on these issues, because that is so important in reaching our communities, in reaching policymakers and decision makers, and doing things like protecting the achievements that we have in the Affordable Care Act and in the federal strategies that we've been able to move forward, but in keeping those victories secure and in building on them, which is our task ahead. So again, welcome to the White House. Thank you for everything you all are doing, and we look forward to all the work you're going to do today. Thank you.
Thank you, Tina. So when we were busy taking selfies and all the pictures, I forgot to mention one important thing. This is being streamed live right now, whitehouse.gov/live. So you can tweet that or put that on all of your social networks. And just in case one of your friends or someone's at home watching, turn out everybody. Maybe we can wave at the camera. It's back there. Wave hi. Hello. Important message today. Pay attention. All right. Again, the address, whitehouse.gov/live. When President Obama formed the Federal Interagency Working Group, he named 2 White House leaders as its co-chairs. We're going to be hearing from both of them this morning. Please welcome Director of the Office of National AIDS Policy, Douglas Brooks.
Good morning. Oh, wow, you do look fabulous in your red. I wore my red tie and my red striped shirt. Welcome to the White House, and thank you all for being here. Thank you, Sean, for the introduction, and Tina for the welcome. And thanks for all of you for being here to commemorate National Women and Girls HIV/AIDS Awareness Day. I particularly want to thank our federal interagency working group who've worked over the last 3 years to develop sound, actionable recommendations for the federal government, and then they have worked so collaboratively and innovatively to implement them. And what are you doing here? Hey! One of the people who has helped do that. I also want to especially recognize Dr. Maggie Chornogorski, who has led this work from our office over the past year. It's just done such an amazing job, and we literally would not be here today were it not for Maggie. So will you join me in thanking her? I also want to thank some women who are here, some who are watching and aren't here, women living with HIV who have partnered with our office over the past 3 years also to bring this work to fruition. And I will also say to them, Tina just alluded to the very important voices that they raised. They raised voices with me last week to remind me that it was important for them to be included in the planning of meetings such as this, and for any exclusion that people felt, and certainly for any hurt that we may have had people feel. I apologize on behalf of myself and our office. 3 years ago, almost to the day, when President Obama signed a memorandum directing agencies to form this group and to dig down to address the intersection of HIV and violence against women, we were in a very different place. Today, all of you in the federal workforce and national organizations and community organizations providing services on the ground every day and in your personal lives have worked tremendously to change the dynamics of the intersecting epidemics. And for that, you should be commended, and we do commend you. Today, we're going to hear from our federal and community partners about new steps we're taking to implement these recommendations and to move forward. Before we go further, I actually want to speak with you very personally here. This issue, this intersection, is deeply personal and very real to me. That confluence, the intersection of violence against women and HIV is very real. In the fact, it's real in the case of my friend Tembi, a woman living with HIV in South Africa whose policeman husband held his service revolver to her head because she wasn't acting like he wanted her to. It's real for me in the example of my lesbian friend Nomfundo, also a woman living with HIV who has to fight off men who think it's their role to change her. It's real in my friend Ntutu, whose lover infected her in her sexual experience, in her first sexual experience, because he was under the male-promulgated myth that sleeping with a virgin would cure him of his HIV. Fortunately, those women, who are truly some of my dearest friends, have triumphed over their abuse and their abusers, and they've gone on and continue to live amazing lives, but that's not always the case. Of the scores of friends and clients I've lost to HIV, one that stands out for me was a woman with whom my family has been friends for 3 generations. I'll call her Margaret. Margaret and my sister Annette were very close, as were their husbands. They lived only a few blocks apart in their Tony, New Jersey suburb, where they had cookouts with their kids, cocktail parties with their friends, and they even traveled together. 22 years later, my sister still recalls with sadness and anger the day Margaret called and asked her to come over immediately, where the last thing my sister expected to find was Maggie standing on the front lawn, bruised, clothes tattered, it's the president leaving, and filled with shame. John, her husband, had violently attacked her, and we would later learn it was neither the first nor the last time. With my sister's and her family's support, Maggie eventually left that marriage. She even met someone and fell in love. Her new partner was a man who, unbeknownst to himself or Maggie, was living with HIV. After his death, his sister told Maggie that she should get tested for HIV. He, in fact, had transmitted the virus to her, and she died due to complications from AIDS. But I submit she also died from shame, she died from trauma, she died from abuse, and she died from the violence that had been inflicted upon her. So when I tell you that this is an issue that is deeply important and deeply personal to me, I want you to believe that. And while it's important for us to stay focused on this issue, this particular intersection, I also want to emphasize our work and our priorities to break down the silos that we tend to work in. What we'll learn today, what we'll see, and that we're beginning to do, is traditional HIV-serving organizations have begun addressing trauma and violence. And organizations like Domestic Violence Hotline, Planned Parenthood, and Girls Inc., all here today, have begun to focus on ways that HIV interacts with women's lives on a daily basis. The work of the Office of National AIDS Policy focuses on implementing across the government the National HIV/AIDS Strategy, which was released nearly 5 years ago. This year, we, along with our federal partners, are working to reassess and release an updated strategy. While the work to address the intersection of HIV and violence against women has existed as an extension of the overall strategy, we're working now to better integrate it into the strategy's principles, goals, and actions. We hope that when we release the updated strategy later this year, you will continue to take up this important issue, and you will see that we have folded it into our daily work, and we will also determine how your organizations and we can continue to meet the goals of the strategy. So we've come a long way. We still need to figure out better ways to deliver services to women and men who need them. We have begun, and we have a lot to be proud of today. But I urge us to keep pushing, keep thinking, keep collaborating, and keep working. And I thank you. With that, it's my distinct honor to introduce to you Carrie Bettinger-Lopez, the new White House advisor on violence against women in the Office of the Vice President. She just started last week, and she's thrilled to be here today. Just briefly, she was most recently an associate professor of clinical legal education and director of Human Rights Clinic at the University of Miami School of Law, and has fought and advocated for human rights in the U.S. and Latin America to change the face of violence against women, gender and race discrimination, and immigrants' rights, among many other accolades. And just before Carrie and I came in, she said to me, I have to get myself updated on the policy aspects of this. But she also said to me that she understands this issue as an attorney who has represented women living with HIV who also have been victims of interpersonal violence. So I think we could have no better person in the role, and ask you to please welcome Carrie.
Thank you, Douglas, for that extremely generous introduction. Good morning, and thank you all for being here today. Tina and Douglas, thanks to you and the White House Council on Women and Girls and the Office of National AIDS Policy for your leadership in this effort. It's truly inspirational. And I also want to thank Dr. Maggie Czarnogorski for spearheading the organization of today's event. It's a pleasure to be here with all of you. This is my first time having a gathering with advocates here at the White House, and yeah, you all do look great in red. It's really overwhelmingly beautiful from the dais over here. So as Douglas said, my name is Carrie Bettinger-Lopez. I'm the new White House advisor on violence against women. I come to you from sunny Miami, where hopefully we will be bringing more of that weather this way in the coming weeks. And on behalf of Vice President Biden, I welcome you to today's celebration, and I thank you for your commitment to tackling the critical and intersecting issues of HIV/AIDS and violence against women and girls. Before continuing, I'd like to thank and recognize my predecessor, Lynn Rosenthal, with whom many of you, I'm sure, have met and collaborated. Lynn prioritized this issue as a matter of national policy and public health during her tenure here. She helped to drive a collaborative federal effort through the coordination of the interagency work group that you heard about, the work group on the intersection of HIV/AIDS, violence against women and girls, and gender-related health disparities. And I know many of you in the room have been a part of that work group. Her leadership helped to draw attention not only to the alarming prevalence of domestic violence and sexual assault against women and girls, but also to the devastating ways in which trauma impacts the health of survivors. I'd also like to deliver regrets today from our office's White House Fellow, Dr. Tiffany McNair, whom I'm sure many of you are familiar with. She's played an integral role in this work and in the organization of the event. She's unable to attend. She's actually in Prague at one of these wonderful White House Fellows gatherings, and so I'm quite jealous. But she extends her gratitude for the remarkable federal and community efforts to confront this complex yet winnable battle. Today's event is intended to celebrate the important progress on these issues, but also to underscore the urgent work that remains to be done. The numbers are staggering and terrifying. You'll be hearing from them, about them from the experts today. Over half of women living with HIV have experienced intimate partner violence at some point in their lifetime. And an HIV diagnosis may trigger violence, while a history of abuse can increase a woman's risk for acquiring HIV, as well as negatively affect her ability to care for herself and to manage the illness. And so we see the problem in both directions, as the speakers before me indicated, and as you'll hear more about. We recognize that this group is one that women and girls of color and other vulnerable groups face at disproportionate rates. As Douglas mentioned, as a women's and human rights lawyer, I have witnessed the devastating twin impacts of HIV/AIDS and interpersonal violence on my clients and those of my colleagues. One client, for example, was a domestic violence victim whose family was her primary support system in the midst of her crisis, but they disowned her after they learned that she was HIV positive. Another client was a gay man who, despite having obtained adequate health services to address his HIV-positive status, succumbed to homelessness after his abusive partner kicked him out of the house. Yet another client was a battered woman whose husband refused to wear a condom and transmitted HIV to her. And so we see the effects of this problem, as you all well know, here at home and around the world. Addressing these intersecting epidemics of HIV/AIDS and interpersonal violence is our administration's priority, which is evident by the President's establishment of the Interagency Work Group. Over the last several years, the work group has worked to identify and implement best practices in 5 core areas and objectives for action. One particularly crucial objective highlights the importance of screening to improve the health and well-being of women living with or at risk of HIV/AIDS who are also experiencing violence. And Tina alluded to this before. We know that screening is a vital tool to prevent and respond to violence and to help women gain access to vital resources like hotlines, shelters, advocates, or restraining orders. And thanks to the Affordable Care Act, screening for intimate partner violence is included, as Tina mentioned, as one of the 8 women's preventative services that are covered without cost sharing. This is a huge improvement and advance. Increasing screening rates amongst healthcare professionals is vital to improving women's physical and mental health. And similarly, trainings and screening programs for lawyers and social service professionals are equally critical for ensuring the safety and well-being of women and their families. So in closing, I'm honored to work alongside so many professionals who are committed to ending the damaging effects of domestic violence and sexual assault, and to protecting especially vulnerable populations like women living with HIV from violence. To effectively tackle this daunting problem, women's advocates, healthcare professionals, researchers, and policymakers, all of us here in the room today must put our heads together. And as the Vice President would say, we must not only respond by stepping out of the darkness, but we must continue to shine a bright light in order to prevent future tragedies. I look forward to getting to know all of you in this room and to hearing your presentations today and to collaborating with you in the future on this important mission. Thank you very much.
Thank you, Carrie. I think everybody here is looking forward to your tenure here at the White House. We appreciate it. As we all know, and has been truly exemplified across this administration over the last 6 years, sound public policy is always squarely based on the evidence. And since launching this initiative to address the intersection of HIV and violence against women several years ago, the science that supports our work continues to expand. Here to share with us now what we know, where we're headed in the future, is Dr. Gina Brown. She's the coordinator of Women and Girls and Microbicides Research in the Office of AIDS Research at the National Institutes of Health. Put your hands together to welcome Dr. Gina Brown.
So thank you for inviting me to come and do this. This is an issue that's absolutely near and dear to my heart. And I also want to thank George, Maggie, Doug Brooks, Lynn Rosenthal, and now Carrie, who are really working hard to make sure that this work gets continued. So I'm going to give you the rapid-fire Massachusetts Speak whirlwind tour of this issue of what we know about intimate partner violence and also how it relates to HIV infection, and then to talk just a tiny bit about where we're going now that we've kind of reached a tipping point and the efforts that are being done across the administration, across the different agencies to have us do this work to really improve upon the issues of HIV and improve upon the issues of intimate partner violence and their intersection. Next slide. So it's well described, it's well defined, and intimate partner violence runs the range from the physical violence that we can often see physically on women, but one of the things we don't talk enough about is probably the issues of emotional abuse, things like stalking, things like making someone feel bad about themselves, and the role that that can play. And this is from the Centers for Disease Control Intimate Partner Violence Survey that happens about every 3 or 4 years, their most recent publication. Next slide. There are absolute definitions of what is considered to be rape, and it runs a much larger range than we often think about. I remember being in a room with some friends, one a physician, one a social worker, and we were talking about the issue in Ohio, and they didn't seem to understand that that actually could be included as something that's called rape, and that anybody should have to really pay for it, and it absolutely surprised me. And so you can see it's everything from sexual contact to using fingers, using objects, and attempted rapes as well. Next slide. So when we use the term intimate partner violence, I used to wonder, why do we use that term? But in fact, if you look at this, the vast majority of violence against women and rape with women is really conducted by someone who's actually known to the woman, either as an intimate partner or as an acquaintance, but it's not the usual kind of stranger attacks that we may hear about on television or the things that we watch on TV. It's often someone who's actually known to the woman. Next slide. And if you look at the data, you'll see that many, in the previous year before the survey, 1.3 million women have been raped. 1 in 5 women have been raped in their lifetime or admit to being raped, and it's probably a bit larger than that compared to 1 in 71 men. A greater number of women being stalked. More than a quarter of women have had severe physical violence by an intimate partner that requires some degree of health care, or that they would get some degree of health care for. Of the women who've experienced rape, stalking, or any physical violence, they've had long-term effects compared to 81% of women compared to 35% of men. And then if you look at the rates, we often try to assign this to a particular racial group, but in fact the rates among white women and black women are exactly the same, about 1 in 5, and about 1 in 7 Hispanic women admit to intimate partner violence in their lifetime. Next slide. The thing that really kind of horrifies me is when you look at when in a woman's life this occurs, and this is a breakdown again from the Intimate Partner Violence Survey, and looking at it, how it ranges when a woman has her first experience with rape, kind of across the age range. And you'll see that 80% of women have been raped before the age of 25. 40% of women have their first rape by the age of 18 years. So 80% by the age of 25, 40% by the age of 18 years. This is a problem, and it's an issue for young women. We also can't forget that women over the age of 45 also have experiences with rape. In a number of studies that have looked at, next slide, that have looked at, oops, there you go, that have looked at the burden of intimate partner violence and what it does to women. Depression in 34%, anxiety 27.3%, suicidality in 10.7%. It has a huge impact on women's lives. Next slide. And if you look at the intersection of intimate partner violence and HIV, we see that women living with HIV have more than twice the risk of having experienced intimate partner or sexual violence than women who are living without HIV. More than 39% have experienced childhood sexual abuse, 42% have had childhood physical abuse, and it's 4 times the risk of treatment failure in a woman who's had recent intimate partner violence as compared to a woman living with HIV who has not. So it really pushes women off that continuum of care cascade, and so they do much worse in terms of their HIV infection. Next slide. A lot of the research that's been done has looked at kind of what a woman's reaction is to having experienced rape or other intimate partner violence. Women end up with a much lower self-esteem. They have an increased chance of having more sexual partners, more risky sex, or having less control over the kinds of sex that they would choose to have and whether or not they're able to use protection. And it puts them in that situation of often being in an unbalanced power dynamic where they have little or no say about their ability to protect themselves. Next slide. So there's a lot of work that's being done around this. It started out it's probably been talked about for years, and I think we've finally reached a tipping point. The Office of AIDS Research in our advisory council meeting in 2009 talked about the biologic relationship between women and HIV risk and what it is that makes them different from men. And one of the things that came out was just these issues of sexual violence, intimate partner violence, and that there may be a biology around this that really changes a woman's genital tract immune function and the ability of that immune function to protect a woman against HIV. And that's sort of a thing I think about when Douglas talked about the person he knew who initially had a partner who was quite violent and then subsequently was with someone she was having consensual sex with who turned out to have HIV infection. And some of the work that's being done is to figure out if those issues of violence, both sexual and other kinds of violence, may actually change her immune function enough that puts her at greater risk for HIV even when she's in a consensual relationship. There's the White House Women and Girls HIV/AIDS Awareness event that happened in 2012 that first really started some of this discussion about the intersection. There's been think tanks that have talked about the biologic relationships, not just the changes in numbers of sexual partners, the behavioral relationships, that have really pushed some research that's been happening, has been funded through the National Institutes of Health to start to provide some pilot data to look at this intersection a little bit better. We have the Trans NIH Plan for HIV-related research that has included these issues of intimate partner violence, this issue of trauma and trauma-informed care for women as priorities for research in women and girls living with HIV or at risk for HIV. And then we have, as I said, we've funded research to really look at this intersection. And then we have the White House Working Group, or the Transgovernmental Working Group, which has played a tremendous role in getting all of us to work together, everything from justice to SAMHSA, HRSA. You'll hear a lot about that later today. And again, to really thank the people at the White House for continuing this work, for continuing to put a focus on the interrelationship of IPV and HIV. Thank you.